Question: A 70-year-old male presents with a sudden onset, severe headache and vomiting. On examination, you note neck stiffness and photophobia. A lumbar puncture reveals an elevated opening pressure and cloudy cerebrospinal fluid, CSF, with an elevated white blood cell count, pleocytosis. Gram stain of the CSF shows gram-negative Diplococci. What is the most likely diagnosis? A. Bacterial meningitis. B. Viral meningitis. C. Aseptic, viral, encephalitis. D. Subarachnoid hemorrhage. The most likely diagnosis for this patient is A. Bacterial meningitis. This patient's clinical presentation and cerebrospinal fluid, CSF, findings are highly suggestive of bacterial meningitis. Here's the rationale for choosing this diagnosis. Clinical presentation: the patient presents with sudden onset, severe headache, vomiting, neck stiffness, and photophobia. These clinical symptoms, especially neck stiffness and photophobia, are classic signs of meningitis. Lumbar puncture findings. Elevated opening pressure. An elevated opening pressure on lumbar puncture suggests increased intracranial pressure, which can be seen in meningitis. Cloudy CSF. Cloudy CSF indicates the presence of inflammatory cells and possibly bacteria in the cerebrospinal fluid. Elevated white blood cell count, pleocytosis. Pleocytosis refers to an increased white blood cell count in the CSF, which is a hallmark of meningitis. It indicates an inflammatory response in the meninges. Gram-negative Diplococci on gram stain. The presence of gram-negative Diplococci in the CSF suggests a bacterial etiology. Gram-negative Diplococci are characteristic of Neisseria meningitidis, a common cause of bacterial meningitis. Now, let's consider the other options. Viral meningitis. Option B. Viral meningitis can also present with headache, neck stiffness, and photophobia. However, the presence of gram-negative Diplococci on gram stain is highly suggestive of a bacterial infection, making viral meningitis less likely in this case. Aseptic, viral, encephalitis. Option C. Aseptic or viral encephalitis can have similar symptoms but typically involves more profound neurological deficits and altered mental status. Gram-negative Diplococci on gram stain are not characteristic of viral encephalitis. Subarachnoid hemorrhage. Option D. Subarachnoid hemorrhage can present with a sudden onset severe headache, but it is often accompanied by a decrease in consciousness, focal neurological deficits, and distinctive findings on imaging studies, e.g., CT scan. The CSF findings described here are not typical of subarachnoid hemorrhage. In summary, based on the clinical presentation, CSF findings, and the presence of gram-negative Diplococci on gram stain, the most likely diagnosis is bacterial meningitis. Bacterial meningitis is a medical emergency, and prompt treatment with antibiotics is essential to prevent complications and reduce morbidity and mortality.